Okay, we are live. Right? Did I do that right? I think I did that correctly. Okay. I hope you guys can hear me. We are going to drive. We are off today. And we're trying some natural deodorant, so we shall see how it goes. Let's see if it closes this garage. My drive is about 40 minutes. My car sounds a little loud. But we're here for another quick hitter because I have not talked to you guys in a very long time. So 2 weeks possibly that I have not updated the group. I haven't reached out to anybody. So we need to update on some stuff. So shout out to those who are at the NATA um, at that conference. I think it's in Indianapolis. So shout out to them. I couldn't go. If I knew I had no obligations this weekend, I probably would have went, but I was on call and found out wasn't needed, which is totally fine. That's how it goes. Nothing new. So last couple lives we talked about what should I major in undergrad. Then we talked about what should I or should I do physical therapy or athletic training? Which school should I go to? We talked about the types of schools, or yeah, public, private, combined or not combined, or whether you do physical therapy first or athletic training first, and what are the benefits to either or of doing in whichever order. So check out those lives. Now we're going to let's talk about some residency and fellowships. So, um, let me fix this. Hello. Okay. When it comes to residencies and fellowships, and sorry if the audio is crazy because my car is literally loud. I've been rocking the same car since school. So yeah, we're trying to save that money because we don't get paid that much. Okay. Um, so residency and fellowship. So we're gonna talk about residencies first. The benefits of doing or undergoing a residency. So and I'm only going to talk about orthopedic or sports. So when it comes to orthopedic residencies, they are a plus if you are an athletic trainer and you did physical therapy school and you want to showcase that you have some like ortho background and the ins and outs, whether it's the clinical prediction rules, et cetera, stuff that you learn in PT school. But also it shows a little bit more prestige, right? So some jobs like PT clinics, like outpatient setting, like there's a clinic that you walk into kind of thing. Some outpatient clinics have orthopedic residencies as part of your you made a deal or a contract that's part of your job, whether you do the residency while you're working, maybe a decreased caseload, and then what else, and then you may have to agree to work with them for another 1 to 3 years, just depending on the entity that you're signing your contract with. So that is a route that happens. There's even the sports residency route that some of these programs, or it could be a hospital setting. It doesn't have to be an outpatient setting. So like Children's Healthcare of Atlanta, I know I'm speaking on only experience. Like there's a lot, way more programs, and obviously on the APTA website, you can go in the subgroup and look up residencies and fellowships, what's accredited. Yeah, so there are several now that are coming out that are sports residency related. Some that are in the woodworks. I won't talk about those that are in the woodworks because I don't know if it's public knowledge yet, so I don't want to disrespect the entity. But when it comes to sports residencies, institutions may also have a sports residency program, or university. So like University of Miami is an example. Duke University, I went to Duke for my sports residency. And Ohio State University, they have, I feel like, 100 million residencies, which is amazing. I just didn't go through that program. Residencies can take about a year, some to even a year and a half. So I don't know if Ohio State has changed their length of their program, but the orthopedic sports residencies is about a year and a half. that was something at that time I didn't want to take on, and I didn't know anything about Ohio as well. But Duke and like University of Miami and some other places, they have their sports residencies for a year, or the orthopedic residencies in general are usually a year as well. There are other institutions, again, on the APTA website that you can look up and see if you would want to like pursue something like that. Say, and now if we go a little bit into orthopedic and sports residencies, I did not do an orthopedic residency. I know several that have done orthopedic residencies, some that I work with, um, and some that took their certification exam. We'll talk a little about that a little bit more. And then those who went through a clinic did got into their orthopedic residency program and then worked with the clinic thereafter. So with the orthopedic residency, and also Duke is another example, they have that as well. So I will speak on Duke in more detail when it comes to their orthopedic residency. Half of the year you're in the hospital, and half of the year you're like in the outpatient and then rotating through different settings and locations just to get your background. So like you're doing didactic material just like you would do a sports residency or any residency, I should say. Um, and didactic can be just with your mentors, and then also could be amongst other residents. So like for example, Ohio State University and Duke University, they will have other residents of other residencies within the organization play a part, whether it's like a case or like a social gathering or something they can learn or do mini projects. That happens as well. And then Duke and now several other residency programs will hold like a weekly or a monthly check-in where everyone takes their turn and talk about a case study or talk about an interesting case, um, whatever, how to grow and just improve each other. Because you could be in a program and don't realize that another program is doing something else. If your program director and the actual program are willing to incorporate those things and do things to improve the program, or just change or adapt to whatever is needed. It's great having those interactions and talking about the case studies and how things are handled, and hopefully help the clinicians, the residents, and the fellows in that sense. So that is the orthopedic residency, and even with the sports residency, you could do that as well. So when it comes to sports residencies, as I already spoke on, like there's programs that um, have that involved with the hiring process or being a staff PT. Um, Usually, not in every case, to be a sports resident or a sports resident, orthopedic resident, there is usually some type of a pay cut. So be aware of that, of some kind. So I will speak of like at least two of the programs that I've been intimate with, whether it's a residency or fellowship, whatever. The physical therapy, like the actual salary, is about 75% of whatever is offered in that area. So like if you're in Atlanta and the going price is, or going salary, I should say, for a physical therapist, and most likely it could be entry physical therapist salary, they'll give you 75 or offer you 75% of that. So that could be it will be like where you're located as well. This thing is shaking a little bit. um, so there's that. Let's see where this vehicle is going. Okay, just want to make sure he's staying in his lane. Uh, anyway, so that's that. So keep in mind with the salary. So with me, I will say I did PT school at Emory, and then while I was at Emory, I actually heard about a residency, really heard about the fellowship first, sports fellowship, and I knew I wanted to do the sports route, even though I was an athletic trainer. I wanted more of the hands-on experience. I wanted a framework that was just going to make sure like I have a system down, or get exposed to a system, get exposed to different things in the sports realm that I wasn't going to get working in a high school setting and doing physical therapy school. So I did that route, or I found out about Duke in particular, As soon as I was about to graduate, I decided not to apply yet. My roommate at the time was applying, and I know it sounds weird when people say that's dumb, but I decided to wait to apply because my roommate was applying, and I'm like, I'm good. It's all good. I can wait. So I waited. So in the meantime, as soon as I graduated, I took on a hospital job at a level 1 trauma center, which is also good. Works on my emergency medicine skills in a way. It was an ortho trauma, acute care. So that was great and gained some experience. And then I decided to do travel therapy. And then that's when I decided to apply. So the application stuff, for example, with Duke, it was like December 1st. Those deadlines you could see on the website as well, not just for the school, but if you are going onto the application website. So it's easy as navigating is just like you can Google, because there's so many acronyms I don't even remember if it's like ABPTS or I'm gonna say it wrong, but you can Google that, just residency fellowships, or you can go under the APTA website and then go through residency fellowships and then the application process, what is required, X, Y, and Z. Usually it's what is required is that you finish from PT school and you graduated from PT school and you took your physical therapy or your NPTE, like your boards, basically. Those are usually the requirements for a sports residency. They may say like be emergency or like so a sports residency. They may say like go ahead and be a first responder. And I talked about in previous lives, like you could do sports medicine concepts, you could do conjugate steps, and those are things that you can do if they require that or put you over the edge and make you a very competitive candidate. So let's see, what else are we missing? So orthopedic residencies are not necessarily requirements, depending if you're going through a clinic. If you're going through a clinic, they're probably going to require you to work for the entity, so keep that in mind. They may, your contract may say like you need to work 1 to 3 years, like I said before, so don't, I don't even want to get into details of how people have gotten out of that. I'll just say like just know that's what it is. Most of the time, not all the time, most of the time. um we talked about salaries already. Let's see here, what else are we missing? Yeah, so benefit of a residency, whether it's sports or orthopedics, if you want to work in the professional sports setting, I would say that shows that you have, it's called a specialty for a reason. It shows that you have a lot more experience, hands-on learning, a structured program, making sure you are very keen with all the updates. So that's another thing. There's updates that happen, obviously. Keen with the updates. You are then, to make sure I know where I'm driving to, keen with the updates. You also are aware of the didactic and the research. You're going to participate in research. You either might be writing, you may be conducting research, whatever that school has involved in there, you're going to get as much experience from the mentors that you have. Yeah, and there's going to be a credential program. So with all that being said, with employers, if they see that, a lot of times they're like, wow, they know their stuff, or they've got some hands-on experience instead of just working, which working is great. So I don't want to ever limit the power of working. You get experience, but sometimes you can get in a habit of getting into habits of things that you're not learning or growing from, or you're not pulling from other experienced therapists, whether they're in your clinic or you have a limited number of people in the clinic, physical therapists, I should say, or it's busy. Like sometimes the clinic, some PTs talk to, they have like 2 patients at a time, and that's like a sign, not necessarily like one patient's a flow over into another appointment. So like keeping that in mind, you may not get the quality mentorship that you want. So having a sports fellowship residency can kind of slow those things down and ensure that you're getting those things. If you are someone that does not want to do a sports residency, it doesn't mean that you're not successful or you're not going to go far or anything crazy like that. It doesn't necessarily speed up the process. For some people, it speeds up the process depending on like your background, your history. But Some people want to do the route where they're working for a year or two, and then they're gaining the experience. So, for example, the requirements, gain the experience, I should say, to then take your sports certification exam or your orthopedic certification exam to be an OCS, SCS, and I think SCS, they don't want you using those letters necessarily, but your sports certification specialty. So with all that being said, you can sit for those certification exams without going through a residency. So that's something you can do. However, there are requirements. Obviously, requirements that you can go on the APTA website, go through again the certification route for whatever certification you want. In this case, we're talking about sports and orthopedics, and see what the requirements are. So for sports, for example, we'll know firsthand the requirements is to have a certain amount of hours where you've been working. So usually you have 40-hour weeks, or you have something that shows that you worked for the length of period that you have, and you're going to need to put that number into the request box. As you put that in the request box, there's going to be an employer that needs to verify that. So then you would eventually send a link via email through the website. It walks you through and requesting verification from your employer, just to ensure that you have the hours that you're saying that you have or that you completed of work. Then for a sports certification exam, there's something called on-field hours, and I think it's about 150 hours. That is something as well, or let's explain what that is. On-field hours is you could be volunteering. Like that's something that, that's why I always tell people volunteer, observe, all the good stuff. You could be at a community soccer game for little kids, for middle school, high school. Does not have to be professional. Keep saying that. Does not have to be professional sports. It could be any level, and you're covering that sports, you're providing medical coverage. You don't have to be an athletic trainer to do that, so it's something to be aware of. You need to be a first responder though, because you don't want to play around and not have any type of CPR, first aid training, and you're covering an event. So another thing that is like another event is like very popular, and you're probably going to see some stuff be like gain a lot of experience and hours, would be the like a running race. So any of those things, like, they count as having on-field hours. Yes, you need to get 150. That is a lot, but it's just to ensure that you're getting exposed to different things, and you're not just trying to sit and take a test and then say, "Oh, I'm a sports certified physical therapist, board certified," and it's just like, but you don't have the experience. So that as well, when you get the 150 hours, you will need to go ahead and get your employer, whoever you went through, to verify those things. So whether whether you got in contact with a physical therapist or athletic trainer, that you've been, say for example, you did this in the summers. In the summer, you didn't have time during the year because you're working as a physical therapist, making money, or you did some on the weekends. Like, you can get them to verify and just keep a running list, a Google spreadsheet, whatever you would like, just to ensure your things. So you're not guesstimating and then run the risk of, God forbid, like, undergoing an audit and things are not correct. So there's that. So those are most of the requirements. We're studying materials for the sports certification and the orthopedic certification. Some people who go through residencies, they feel pretty adequate on taking the test with the didactic material they're learning through the residencies. So it's something to be aware of. But there are materials that are listed on the APTA website, and also I think Evidence in Motion, MedBridge, those are great resources to study and use. They have a very high, over 90% passing rate. So that's something that, great resource. And they're not that, well, I know MedBridge is not that expensive. I can't speak on Evidence in Motion. I did not take Evidence in Motion. I know several who have, and they liked it, and they thought it was very helpful. But I did not take that. And honestly, I did not study for my sports one, because my sports residency didactic wise was very good. I think if you go through a really good program didactic wise, you'll be fine with your sports certification. So same thing with the orthopedics. If you go through a great residency program, there's great reviews, a lot of things, and they're already certified, you most likely will have a great experience and have great study material throughout your residency program to then study for your exam. So yes, so that is residencies, sports, and orthopedics. Okay, we're at the 20-minute mark. Let's see if we can get this wrapped up in another 20 minutes or less. So that's the residencies route. So now I will speak from my experience. I did a sports residency. I was already an athletic trainer, certified athletic trainer. I've already completed my physical therapy school, passed my boards for both athletic training and physical therapy, was at Duke University for our residency. I had a LinkedIn, as we keep telling you, as everyone, I post as many internships, jobs, opportunities, anything that I could think of on LinkedIn. I was contacted via LinkedIn first by a professional basketball team while I was in my sports residency. So that's something that just giving you an idea of not just saying the residency did that, not just saying being physical therapy athletic trainer like did that, but it does help when you have when you have at least those two. I will say, I think if you're a physical therapist, athletic trainer, and they see, I think you catch the attention of jobs, whether that is to give you some feedback on how to move forward or what to do to make yourself a very competitive person. I was the first Black female, or I still am. No, I'll just say I was. I was the first Black female as a physical therapist, athletic trainer to work in the NBA. So I knew I had to jump through a lot more hoops. It is what it is. But the great thing is, I don't think people have to jump through as many hoops as I've seen in with my very own eyes, which is amazing. So I think that's how it should be. The good quality education. I feel like you don't have to go through steps to get to where you would like to get to. Um, so when I was in my residency, I was contacted by this team and they gave me great feedback after I had some interaction. I would say more of like um, I don't even want to call it an interview, but just through conversation, I found out it was like, okay, with Duke's program, great program when it comes to didactic material, but I wasn't having the hands-on of working with the strength conditioning coach, working with a nutritionist, working with a chiropractor, working with another physical therapist, athletic trainer, a DO, and how do you make sure that the player is in the center of it all? And I didn't have that experience. If you did the Duke Sports Fellowship, I would, but because of the program I was in, I got great framework on the treating the clinic and orthopedics. I think I had a really good orthopedic uh, basically experience in that realm, and also like working at the nearby high schools, that was great. So yeah, so I think the feedback I received was like, hey, do a sports fellowship. And at that time, sports fellowships, now we're going to carry over to sports fellowships. I don't really know of too many orthopedic fellowships, so I don't want to like speak prematurely on that. So I'll speak on the sports fellowship route. There's not that many programs. There's less than 10. There are more that are going. There are more that are occurring, I should say, that are coming about, but a lot more sports residencies that are coming up, which is great, which is awesome. The sports fellowship, all these things are not required. These are things that just put you over the edge, and I want to be put over the edge. I knew I wanted to be in the NBA, and I knew there was not another physical therapist or athletic trainer that looked like me. So that's why I did what I did, and that's why I took that feedback. So when it came to sports fellowships, I'm not gonna just talk just about my story, just kind of help you guys. It gave more autonomy. So for sports residency, talk to people who were, some at like VCU and Duke and other institutions. Great programs, great didactic material, um, great hands-on when it comes to certain levels, but not necessarily getting the college experience or working with college athletics. So that's where it gets kind of like, okay, this is great, but I'm not getting all that I need. So the sports fellowship, what I did, there is Wake Forest. There are other programs, sports fellowships. There's not that many, but for me, it actually was like a great stepping stone to then make it to the professional sports setting. I had my own caseload in the clinic. You have your own caseload, or you start growing your caseload in the actual athletic training room in the collegiate setting. So you're seeing college athletes, which I think that's important. Whatever division it is, but usually they're going to be Division One or they're going to be military, but not necessarily going to qualify as a civilian when it came to the sports fellowship I saw for the military aspect. And then they have a overhead. There is an overhead athlete fellowship, and that is with Ohio State. And I think there's more programs coming out, as we said. Obviously, there are actual professional teams that are coming out with fellowships. I posted one already on my LinkedIn, so that's why I say check out LinkedIn. The Tampa Bay Buccaneers had, I posted their physical therapy fellowship. Obviously, when it comes to specifics of that actual team, there are going to be their own requirements. So it's not necessarily the same as like those who are APTA and within the residency fellowship route and have the requirements if they're accredited or not accredited. But they're great programs, and you can imagine those fellowships, or even sometimes or internships, turn into a professional job that may not be with that actual team, but may not be with that actual team, but then sets you up for wherever you want to go. And I think that's where I'm a huge fan of internships, if you can do that, even if it's in the collegiate setting. And then now, as we're talking about fellowships, getting back to fellowships, when you need to show that you have some experience working with a strength coach, because that's what you're going to work with. If you're a physical therapist, athlete trainer, you're doing anything on the medicine side and you're not doing strength conditioning side, you're going to be working with the strength conditioning specialist. So you need to know how to work with one. You need to know if that strength conditioning specialist is already a physical therapist or are they not a physical therapist, because that is something that is becoming a lot more common, not just in the NBA, but the NFL. That is starting to show up a lot more, which is awesome, and seeing that growth in that. You want to make sure you're not disrespecting another healthcare provider by oversharing information, and that's something that I had to learn. Not saying I'm a master at everything with communication, still working on all of that good stuff, but I think the fellowship really helps within a nutritionist and the players' goals. And now you have maybe you have a rehab director, and then you have the coach you need to communicate to. All that stuff you need to keep in mind. And the fellowship was like, that was like that hit it on the nail. Exactly what I needed, the feedback I needed, the reps I needed. And especially at Wake Forest, as their sports medicine clinic was located in the same building as Chris Paul's basketball academy, CP3. That was just like amazing, because I love basketball. Whether I stay in basketball or not, whether I continue or I'm asked to still be here, like it was just a blessing just to love basketball, be involved in basketball, and then the fellowship tied a little bit into that, and the location that just helped flow right into my job that I have right now. So I would say the fellowship also, it takes you over the edge, not required. There's not a board exam with that, so that keeping that in mind. So it's not going to get letters behind your name or anything like that. But the experience and showing that on your resume, on your LinkedIn, that plays a huge role. It shows that you went over the top for that. Another fellowship that people don't talk about, some are aware of, but I don't think a lot of people, physical therapists, realize how powerful this fellowship is in the professional setting. That's if you work with the athlete personally, because you don't want to work with the team. You work with the team, you work in the NBA, NFL, MLB, whatever it is. If you're on the medical side, meaning a physical therapist, or you're duly credentialed, but you can't unfortunately just be an athletic trainer. You have to be a physical therapist under the APTA and the residencies and fellowships, is being a FAMT. So a fellow in and manual therapy. Manual therapy is something that, man, will take you over the edge. And I feel like with physical therapists, if you gain some work experience, I really think it really turns your practice up a notch. And I say practice, not meaning your practice in a clinic, your practice as a clinician, your experience, your growth. So when it comes to you may talk to your friends, talk to your family members. A lot of times they go to chiropractors, and it's like, that's great, chiropractors, but physical therapists can do those spinal manipulations, and not just to the spine, but also extremities, like stuff that's in can do. Obviously, know your state practice act. If unfortunately, there's some states that still do not have those rights, and hopefully that will change with um with a good fight. And it's something that I feel like if I were in that state, I would definitely need to like fight for that. Um, but when it comes to spinal manipulation, we can do that. That's something that I will say you learn that a little bit in physical therapy school. So I'm not saying that you don't ever learn that. So you learn that, but it's such an introductory. Um, it's such an introduction, to be honest. I think doing a fellowship, you have to. There's research obviously involved, so that part's not necessarily. But you're gaining so much in depth. It takes your orthopedics to a whole nother level. Understanding how the body, how it's going. There's a lot of programs. I'm in right now the American Academy of Manipulative Therapy, or some people may see it online as Spinal Manipulation Institute. That is by Dr. James Dunning. That is a great program. It is not cheap, so that's something that I would love to tell people. It is not cheap. Usually with manual fellowships, you are not getting a salary, so keep that in mind. I don't think people know that until you sign up for the program or you're actually researching the programs. Um, Ola Grimsby is another one, Institute. IRA. So IRA is becoming very popular. You may see it advertised. You may see it at CSM when you're going to conferences. You may see it everywhere. A lot of physical therapists that are in the league as well, they went through that program. I think Evidence and Motion has one, and then Regents has one as well. That's more of like a hybrid. You don't actually have to go to these places, but a lot of times they're hybrid, meaning they are going to be in person and all online, and maybe mostly online, and then some in person to obviously practice some of the skills. You know, practice how to, cervical manipulation, on the, say if you need to get the right side or get the left side, or if you believe it's a bilateral event and you need a, when I say crack, I don't really mean as a chiropractor speaking on like the spinal manipulation on that aspect. So different, getting into that detail is probably not the most important, but I'll say like having that FAMS or that training or still in that program, whatever it is, that takes you up a notch. That, like, I feel like is like, if there's a point scale, that adds like 10 points to your like credentials slash competitiveness as a candidate to like work with like athletes in the sports setting, etc. And so I feel that is something I would definitely advise you like to do that. But I would advise have a job that is a lot flexible, because you're gonna have to get hours, which we call like supervisor, so like supervision hours technically. Make sure I'm going the right way. I'm taking so many highways to get to this place. That's hilarious. We in the country, Oklahoma. Yo, where the hell am I going? I'm going to see a friend, and I feel like I'm going to Norman, which is like, there's a big university, but man, I'm like driving, taking all these different highways, and I'm like, I see nothing but grass. And not even green grass, but grass. I'm a city girl, so I gotta get used to this. Oh, wow. Okay, back on topic. We're at the 34 minute mark, so let's start wrapping some of this up. So, we were talking about fellowships. So somebody's texting me. I'm texting later. Fellowships. Is that a school? Oh, Cleveland County Detention Center. Oh my gosh. Okay, never mind. Wow, I've never been over here before. Okay, so when we talked about that manual fellowship, usually those programs, yes, they have research like we talked about. There's going to be some on-site learning. A lot of it will be online, and there will most likely be a portion that you have to get hours under a physical therapist who's already a FAMS or a fellow in manual therapy. And getting those hours, they have changed since COVID. So please look at those hours and make sure you have the hours. Some supervisors or physical therapists make you pay. So that's something to be aware. As well as we talked about, you're not getting a salary, so this stuff is out of pocket. My program that I went through is $12,000 on paper. So on paper, and I'm not going to get into this little rant. Besides, there's other fees. Let's just put it like that. There are other fees. Um, you have to travel to the place wherever it is, wherever your classes are, those things. So, but it's actually worth it. Because once you have that on your resume, you are like, you are a hot mama. I know that's not professional to say, but you are really sought after. And also, it just helps you, even if you're in the job you want to be in, just helps you with your skills because there may be a player that comes to you and it could be like 5 minutes before the game's supposed to start or 5 minutes before tip or whatever it is. And they're like, oh, my neck. And you're looking at, you do a quick assessment, you're evaluating, making sure everything is good. Look at, as you see, and there's other videos I talked about, like checking cranial nerves and all that good stuff and what you need to do before you do a spinal manipulation. And maybe you need to crack their neck or do a spinal manipulation or cervical spinal manipulation. So keeping all that in mind in that sense. So I think our next video, we need to chit chat a little bit on certifications. And I think the certifications will be useful on like, dry needling. Say if I don't want to do a fellowship, but I want to get a spinal manipulation certification. That is possible. Or you just want to be certified in manual therapy. That's also something. Certified in BFR training. That's useful. SFMA, MS, all those things are useful. All those things are very um, attractive to teams or wherever you want to go, or even if you want to open your own practice or you want to work with a player, and you don't want to work with a team, you want to work with a player, like all that stuff, like all those things are useful. So I'm actually close to my destination and we're getting to our 40-minute mark and I want to keep this under an hour because as I said in the previous lives, I want to be able to tell players, hey, go check out this video. I'm getting the same questions. I'm going through the DMs and I cannot answer them as I just can't answer them. There's too many messages. And I appreciate the messages, but because I'm trying to help as many people as I can, I'm going to have to just start saying, hey, check out this video. Hey, check out this video because um, I need to help as many people as I can. I think if I just go message by message, people are going to be waiting 6 months before I get to them because the messages just keep coming in and I'm not able to keep up because I still work a job. I think that's what people forget. I still work a job. I still have a life, like I'm married. Like I have a job that's not a regular job, meaning um I don't have I don't check out. Like it's not like I work 8 to 5 and that's it, or 9 to 5 or whatever that is. So it's a lot of hours traveling. Just came from Miami, for example. I'm heading out again to 2 other states. So in a day, that's just how life goes. So I appreciate you guys. Thank you for the love and support. I need to go find some parking because I'm at my destination. I know all you see is grass right now, but I'm at this location. Just need to figure out where to go. Um, and that's pretty much it. And we're at the 38, about to be 39 mark. So appreciate y'all and be on the lookout for new videos. Bye.